Another very exciting development that we're presenting, and we've already presented actually at the meeting, are some renal data. And this is very important because diabetic kidney disease is a high unmet medical need as a complication of diabetes, and it leads to incredible morbidity and mortality. And what we've seen looking back at our data is that there is a stabilization of renal function compared to glimepiride. So in a comparator trial, we've seen that patients on glimepiride lose kidney function over time. The patients on Invokana in that trial appear to have a stabilization of their kidney function. Great implications long term for what this can mean to patients with this devastating complication. And in fact, it bolsters the reasoning behind our Credence study, which is a phase 3 outcomes trial that's actually looking specifically at the use of Invokana for preventing the progression of diabetic kidney disease. A third very exciting thing that we're bringing forward, now these are two very different things I've already told you about, obesity and diabetic kidney disease. A third entirely different area is Invokana in patients with type 1 diabetes. And there we've done a trial and we've seen some very interesting findings with respect to not only glycemic control in these patients, but patients getting Invokana compared to patients given placebo had less variability in their blood glucose, so less time out of range, less swings in their blood glucose. And this is a potentially very important finding for patients with type 1 diabetes, but we also have to temper it with the finding that we also saw more ketoacidosis in those patients with type 1 diabetes. So it's a very interesting finding, and again, we're looking at all of the possible implications of this. On top of that, again, there's a number of other posters and presentations being given at the ADA, which we find to be a wonderful meeting, not only for networking, but also for bringing out these scientific findings. From a perspective of the growth of cardiovascular metabolism as a research and development enterprise in Janssen, I'm very pleased with where we are compared with this time last year. I've been with the company for a year and a half, so it's been a building cycle for us. We have built out our pipeline quite a bit, and we continue to do so. We've now moved a homegrown molecule, a GPR40 agonist, into first-in-human studies. We've also brought in-licensed a molecule, an oxyntomodulin, which will be going into phase 2 studies this year. So this illustrates our approach of being agnostic to whether we bring innovation internally or externally. We've had some fantastic additional hires to our already deep talent pool. We brought on a new head of discovery, Mark Arian, and we brought on a new head of translational medicine, Marion Vetter. Both are specifically for the cardiovascular metabolic disease area at Janssen. So I think we're really starting to hit our stride there. And of course, our marketed products are doing very, very well on the market, with Invokana being the number one selling SGLT2 inhibitor, and Xarelto in the United States, number one novel oral anticoagulant. I hope by this time next year to be able to tell you news about some more developments in the pipeline. We're going to, of course, in 2017, and I can't promise this by ADA, but in 2017 we're going to be seeing the results of 2 of our large outcomes trials for Invokana, the Canvas and Canvas-R studies. And again, that's an opportunity to change the face of how we treat diabetes.